What genetic mutations cause devastating conditions for USMLE? Imagine a tiny change in your DNA that can cause a disease so severe it affects your entire body. That's what some genetic mutations do, and they often show up on the USMLE Step 1. These mutations are the root of many inherited diseases that doctors need to recognize. Let's explore the main types of mutations that lead to these serious conditions. First, point mutations are single changes in one nucleotide in the DNA. They can be missense, where one amino acid in a protein is swapped for another, like in sickle cell anemia caused by a mutation in the beta-globin gene. Or they can be nonsense mutations, which create a premature stop signal, leading to a shortened nonfunctional protein, as seen in Duchenne muscular dystrophy. Silent mutations don't usually change the protein but can sometimes affect how genes are spliced or expressed. Next, frameshift mutations happen when nucleotides are inserted or deleted in numbers that are not multiples of 3. This shifts the entire reading frame of the gene, often producing a completely different and non-functional protein. Tay-Sachs disease and some types of cystic fibrosis are caused by these kinds of mutations. Then there are triplet repeat expansion mutations, where a sequence of 3 nucleotides repeats too many times. This abnormal repetition causes disease by either gaining toxic function or losing normal function. Huntington's disease is caused by an expanded CAGS repeat in the HTT gene, while Fragile X syndrome results from an expanded CGG repeat in the FMR1 gene. Splice site mutations occur at the junctions between introns and exons and interfere with normal RNA splicing. This can lead to missing or extra pieces in the final messenger RNA, causing diseases like beta thalassemia. Large-scale chromosomal abnormalities involve whole chromosomes or large parts of them. For example, having an extra copy of chromosome 21 causes Down syndrome. Trisomy 18 and trisomy 13 lead to Edwards syndrome and Pothouse syndrome, respectively. Deletions or duplications of chromosome segments can also cause syndromes, such as DiGeorge syndrome, which results from a deletion in chromosome 20 to Q11. Specific gene mutations are linked to many devastating conditions. Huntington's disease is inherited in an autosomal dominant pattern due to CAGS repeats. Neurofibromatosis type 1 results from mutations in the NF1 gene on chromosome 17. Polycystic kidney disease often involves mutations in the PKD1 gene on chromosome 16, leading to cyst formation and kidney failure. Li-Fraumeni syndrome is caused by mutations in the tumor suppressor gene TP53, increasing early onset cancers. Cystic fibrosis usually results from a deletion of 3 nucleotides in the CFTR gene, affecting chloride channels. Sickle cell disease is caused by a missense mutation in the beta-globin gene, producing abnormal hemoglobin S4. Medical students. Understanding these mutations helps in diagnosing, predicting disease severity, and knowing how to test for them. Techniques like polymerase chain reaction and gene sequencing are essential tools. Recognizing inheritance patterns, mutation types, and their clinical effects is key for problem solving on the USMLE. These mutations are the foundation of many serious genetic diseases, and knowing them is vital for future doctors to identify and manage these conditions effectively.